But first up, let's cross back to Melbourne to catch up on the latest developments down there. I'm joined by the Chair of Epidemiology at Deakin University, Catherine Bennett. Good to talk to you again, Catherine. We just heard earlier in the show that we understand the health and the government authorities in Melbourne are meeting this afternoon, that a snap lockdown is on the cards. What's your assessment of the situation so far? Do you think that would be another preemptive move, that they need to wait yet and see whether they can get on top of this thing without a lockdown?
Look, what the data we've seen so far wasn't enough to trigger a lockdown, so that was good. I think it's been a very reassuring, confident response, but also one that I think is proportionate. What they're waiting to see is the results of the other 220 close contacts, because the risk there is, even if they're already linked and even if we're not surprised because they're very close contacts, if there are enough of those people who turn positive and they have been to a number of exposure sites, because quite a few of these cases have been historic, a week old already, that's the concern, that then it could overwhelm the health department. So if there's a lot of cases out of this batch, that would be one trigger. The other is if in the many thousands of people getting tested, which is brilliant to see that, but if they find some that particularly are from some of the exposure sites, so they're linked, but they're the very casual exposure sites, if they found anyone turning positive there, that would ring some alarm bells as well, because they'd be concerned there could be a whole lot of other cases yet coming forward to be tested and identified. And clearly, if we have cases we can't link, then that would be more worrying again. So that's what they'll look for in the data that will be coming in late today and overnight. That will, I think, determine where they go with the next steps. But so far, I think it's been proportionate, and I don't think they'll jump in for the sake of it. I think they're holding off to till they get the latest numbers to really, I guess, get a handle on what the risks are.
Well, let's hope they hold off because they're going to have to hold their nerve, because as you've revealed previously, their last lockdown over the Valentine's Day weekend was unnecessary. It didn't contain any people who weren't already isolated.
That's right, Chris. Then it was a safety net or an insurance policy, and thankfully we didn't need it. And that's why I think they're now really looking at this closely. We've got a few cases, for sure. These are cases that have been found by searching back from the one case that started this whole investigation. So it's not like the cases are increasing every day. It's the ones we're finding, that number is increasing each day, and that's because they're chasing back through the contacts. So if they don't find much more beyond the ones they've already found, then I think this is the right strategy and they've got it in hand. But if there's other warning signs to them, then that's what they'll tell us. That's how they'll explain if an outbreak response needs to include a lockdown, then I think that's where we'll go next, will be that full explanation, because they know that people, need to understand why these things matter. But hopefully not. We haven't had any results come out this afternoon. Yesterday we did see some come through. So, I just keep an eye on my phone, but every hour where we don't have more cases announced, hopefully means that we might have a few more overnight, but not large numbers, we hope.
Well, we're already seeing state borders being thrown up. South Australia closing off to the Greater Melbourne area from 6 o'clock tonight. We know if these numbers in this situation were around in New South Wales at the moment, there'd be no talk of a lockdown. How confident are you that the Victorian authorities now will be confident about their own processes?
Yeah, look, I don't understand these border closures, Chris. I think, if someone's really high risk exposure here and they know it and they've been to one of these exposure sites, then they are identified and in quarantine. So they're not travelling anyway. You don't need to close your border to those people. But in some states, Queensland in particular, if you've actually been at a low risk site, what we call tier 2, here you just have to test negative, and then it's all okay. Particularly if some of these sites are a week ago and you test negative now, you're probably okay. Very low risk. Go to Queensland, you have to go into hotel quarantine. So it, to me, is not proportionate and takes that whole idea of a hard border closure even further. Yeah. So I think the states need to work together. We need to contact trace if we need to, if it crosses borders, carefully and cooperatively, but not put in risk measures that are actually more harsh than the state that's actually managing the outbreak in the first place. To me, that's very strange.
And remind ourselves that 90% of the people who were killed last time were in aged care homes, and now most people in aged care homes have been vaccinated.
That's right, and it's a very different situation if we can keep the virus out of aged care, which is one of our primary, focuses, but also the other workplaces that accelerated the virus last time. Then it's a very different outbreak to manage, and
Indeed.
we've already seen how people have stepped up for testing. Mask wearing's a smart addition because it just slows everything down and probably slows people moving around a bit as well. And keeping people's home gatherings to smaller numbers is just an extra safety measure. And if everybody's stepping into those things, that creates a safer environment for this investigation to continue. And that hopefully will be enough because the people are on board. It is a partnership with the health department. They're doing their job. Let's hope it's enough to wrap this up pretty quickly.
Let's hope so indeed. Thanks for joining us again, Catherine.
Thanks, Chris.
Catherine Bennett there. Let's be optimistic. Hope Victoria's on top of this. They don't jump at that lockdown.